All right, it's been 1 year since we learned first of COVID-19 infections in the United States, and the pandemic is one of, if not the biggest issue facing President Biden in his first few days in office. The new president will unveil his plan to fight the coronavirus today, and he will sign 10 executive orders, which include invoking the Defense Production Act to address vaccine and PPE shortages and requiring masks on public transportation. Dr. Ron Elfenbein is the medical director and owner of First Call Medical Center. He is here now to talk about the president's plan and the latest on the COVID-19 vaccines. So, Dr. Elfenbein, the president's plan also wants to see all U.S. schools open in 100 days. From your standpoint and your experience, what needs to happen in order for schools to be safe for students and teachers to finally get kids back in the classroom and away from distance learning?
Well, good morning. I think we've discussed schools a number of times on the program, and I think I'm very much in favor of opening up the schools, so I'm glad to hear that this is a priority of the new administration as well. Obviously the vaccination, now that it's available, needs to be available for teachers and for faculty and for anyone who works in the school who would be exposed to large numbers of people. They also need to have very stringent cleaning protocols and things like that to keep the kids safe. Obviously, the vaccines are not FDA authorized for children at this point. So, they still need to be vigilant. The kids still need to wear their masks. They need to wash their hands. They need to maintain social distancing. All the rules that we've been talking about for all these months still need to be in effect and still need to be really, really followed very carefully. But I think primarily, really, we need to just see that the teachers are vaccinated because of their high degree of exposure. Even though, we know that little kids pose a smaller risk than, say, high school students. But regardless, if you're going to talk about across the board opening up schools, I think every teacher should have the option to get vaccinated.
So, Doctor, we've been reporting on vaccine shortages in various places in the U.S. People calling up because, they're over 65 and they're told, we'll call you back when we have the vaccine. From your perspective, how's the vaccine rollout going? And I'm really curious what you're seeing in Maryland, because it certainly seems as if, depending on where you are, you're having a completely different vaccine experience.
Yeah, that's a great point, Anne-Marie, and that's very true. It really depends on the state, and even beyond that, it depends on the county and the municipality in which you live. I'll give you an example. My urgent care, we test a lot of people every single day for coronavirus. Upwards of 600 people a day we're testing. And a neighboring county offered us vaccine almost 3 weeks before the county that our facility is located in. And that was just because that the health department of the neighboring county had their stuff together a little bit faster and a little bit better than the county that we're in. So just being in one county versus another makes a big difference. So, the rollout has not gone as well as we had hoped. But I just want to temper this by saying that, you have to put this into perspective with this really major scientific achievement that this entire program, the vaccine in general, really has achieved. I mean, we've talked about this before, but I really do mean it, that it is on par with putting somebody on the moon and bringing them back safely to Earth. I mean, it is an unbelievable, unprecedented scientific achievement that we are where we are at this time. So, yes, the rollout has been a little slower than we anticipated, but as we've discussed before, it's a huge logistical undertaking. So I'm going to give them a little bit of slack, and by them I'm saying, the feds, the states, the counties, and even the hospitals. The hospital rollouts haven't been perfect. I mean, I have friends of mine who are ER doctors who pathologists have gotten the vaccine ahead of them, and the pathologists don't touch people. So why is it that a pathologist should get the vaccine ahead of somebody who's working in the emergency room? It's just, there's bumps, there's hiccups, but in general, they're doing a best job that they can. And it is an enormous undertaking to do what's being done. So yes, it hasn't gone as well as we had hoped, and you can always criticize, but I think at the end of the day, we really should recognize just how amazing this achievement truly is.
It will be a signature legacy of President Trump's administration, this Operation Warp Speed, because in the history, in modern medical history, getting a vaccine out for a deadly disease at the speed at which we were able to do that is unprecedented, as you say, Doctor. So you're absolutely right about that. Let me ask you about this new research from Rockefeller University in New York that suggests that the Moderna and the Pfizer vaccines aren't as effective against COVID-19 variants as they are against the original virus. Now, some researchers were concerned about these preliminary findings, saying that if the virus continues to change, it could affect how well these vaccines work. So given that we're already seeing the virus mutate, are you worried?
Yeah, so I think you hit the nail on the head in your statement there, Vlad, when you said it's preliminary data. And I think that, yes, we should be concerned, but worried, I would not use the word worried. And the reason I say that is that this was a very small study. They took 20 people, and what they did was they took blood samples from people who had been vaccinated with either the Moderna or the Pfizer vaccine, and it was only 20 people. And they took blood from them, and they measured antibody levels, and then they took it to a laboratory, and they took those antibodies and they put them up against the new variants that we're seeing in various countries throughout the world. Now, that is what we would discuss and we would determine as an in-lab study, not an in-the-body study. So an in vitro versus an in vivo study. So it's very limited because remember, your immune system is not just composed of antibodies. There's other cells that are involved and other things that happen with your immunity. So this was not looking at the human body's response to the virus. It was looking at the antibodies. That's it. And the antibodies were still effective. They were just a little bit less effective than they are against the original strain. So yes, it is concerning. And yes, the fact that these mutations will pop up, we know they will pop up because coronaviruses are fairly mutagenic viruses, meaning that they do mutate naturally. This is what we expect to happen. And as you put downward pressure on any microorganism, just because of natural selection, it will kind of find ways to go around your downward pressure. So the idea is you got to put as much downward pressure as fast as possible to try to minimize the amount of sort of the sneakiness that the virus can do to get around your defenses. So the quicker we can put all that downward pressure and the more pressure we can put, the better. So, the vaccine rollout is really important for that. But I would really caution you and your viewers to say that, yes, it is concerning, but I would not use the word worried. And I would, caution people that this is preliminary data using very, very limited numbers of people. It has not been peer reviewed, and it is only looking at studies in a laboratory, not in the human body. So very, very important distinction.
Dr. Elfenbein, thanks for giving us some context and some perspective. We really appreciate it. Thank you.
Thank you.